Great. So, pleasant day to all of you. So, I'm going to have a recorded lecture lang for the physical and sexual self nga lesson. Since discussing this topic would require nga 1 hour ni siya nga i-discuss, and it seems that I was able to find out nga Google Meet only has a limited nga time allotment, like 40 minutes nga, and that time is not enough to discuss this topic, no? So hopefully I'm going to be able to discuss it in less than 30 minutes or 40 minutes, no? So okay, so for the learning objective for this lesson, at the end of this recorded lecture, I hope it is hoped that you'll be able to discuss the developmental aspect of the reproductive system. Also describe the erogenous zones, explain the sexual behavior of human person, and characterize the diversity of sexual behavior. Describe sexually transmitted infections, so there should be a correction, Anna. And also discuss the natural and artificial methods of contraception. So let's start with the physical self. So we're all aware that our body is an extension, no, of ourself. It's how we express ourselves and our presence to others and to our external environment. We sometimes realize the importance of our body when we don't take care of it or if someone does not value it. No, we usually um, we usually give importance sa tong body only if masakit ta or if mag na ay mo pasakit sa ato, no? So that's the only time nga murag mo value gud ta sa ato ang own nga body. We're only given one body, and we have to take care of our bodies, no? Now there are some things that our body actually experiences, no? These are some of the changes nga na happen during a certain stage, and some of these changes might in a way might actually surprise you, but it's actually completely normal, no? So for the next slides, I'll be discussing these changes nga gakahappen sa inyong bodies and their importance or ang ilahang role in the development of your physical nga self. Okay, so it has been believed that the sex chromosomes of humans define the sex, whether a person will come out as female or male, and whether they will have male or female nga secondary sexual characteristics. So, I think most of us are already familiar with this, no? In your biology nga class nga for XX chromosomes, you will have a female na person. Then for XY nga chromosomes, it's usually a male nga human person. Now, during the early stages of human development, the embryonic reproductive structures of males and females are alike and are said to be in the indifferent stage. So, during the time nga mag-meet ang sperm o ang ovum, no, ma-fertilize man na sa sperm ang imong ovum. So, mag-undergo na siya og series of changes in which ang isa ka cell, a fertilized cell kay murag same ra siya og porma sa isa ka fertilized nga cell sa isa ka female ug ang male. So, wala ra jud kayoy any differences ana, no? Mura bitaw siya og kanang mura bitaw og how do I term it? Murag raspberry ang yang shape bitaw nga maporma siya. So dili wala pa kayo di pa nimo makita if naa na siya kanang mga organs, no, for you to determine if that cell is actually a female or a male, no. And there's also this stage called puberty. So the period of life generally between the ages of 10 to 15 years old. This is when the reproductive organs grow to their adult sizes and become functional. Now, mag-skip na ko ato nga part nga na-develop or na-develop na ang isa ka zygote into a human nga fetus. Ang fetus, this is actually where naanay naporma nga mga organs, naanay naporma nga part sa body sa isa ka fetus. Ma-distinguish na siya if male or female ni siya nga fetus, no? It's usually through the technology of ultrasound nga may bal-an na sa isa ka pregnant ka mother if ang iyang child is actually um male or female, no? Now, let's skip to that part nga mag-childhood siya. Let's go to that part nga mag-puberty na ang isa ka person. So, muna siya ang stage sa isa ka development sa isa ka person nga daghan kay bodily changes nga gaka happen, no? Kay grabe ang production sa hormones sa body sa isa ka person. This is usually around 10 to 15 or sa imong teenage or adolescent nga years, no? Most of you are already in legal age, so you're still under this, no? You're still actually undergoing a puberty nga stage. It usually stops at around 25 or before your 30s, no? This is usually characterized by the development, enlarging of, for the females, enlarging of breasts, ang buttocks kay murag makuha na pod, ma-widen, and sa males is enlargement of the sexual organ, growth of facial or groin, pubic hair, no? Yun nga na. And also, ma-develop na pod ang height, mag 'di ba makabantay man mo if ever na mo'y kanang sibling or relative nga laki nga murag mabantay ninyo nga murag mo taas na sila. And also in some cases na upod for the females, no, nga mataas sila, and usually murag kana bitawng there's that aura nga mo bloom jud sila, no, blooming ilahang kuan. They're at the peak of their development. Now, let's talk about some of the disease associated with your reproductive system. So, this disease are usually a result of the malformation of some of the cells responsible for the development of those reproductive nga system. Okay, so let me just pause for a while. Okay, so to continue, so we also have what we call orchiditis, inflammation of the testis, commonly in an adult male, na neoplasms na ay abnormal mass of tissue nga gaka-form when cells grow and divide more than they should or they do not die when they should. So these neoplasms could be benign or malignant, no? Then we also have a human sexual behavior. So the human sexual behavior is defined as any activity or that can be done in a solitary or with another nga person. It could be solitary between two persons or in a group. That it induces sexual arousal. So, two major factors that determine human sexual behavior, that could be your inherited sexual response patterns, and also, to some extent, the degree of your restraint. So, kato, duha ka buok ka socio-sexual behavior that can be done with yourself or when you are on your own, and also you can also do it with someone, with another person, and ang solitary behavior nga activity that can also be done with another nga person, no? So, for solitary behavior, this is usually referring to self-gratification. It means self-stimulation that leads to sexual arousal and generally sexual climax. Usually, most self-gratification takes place in private as an end in itself, no? but can also be done in a socio-sexual nga relationship, or it could be done with someone, no? So the usual colloquial terms for this is masturbation, self-stimulation, no? Kanang you're jerking off, you're wanking off, no? Something like that, no? So you're trying to achieve sexual climax or sexual pleasure on your own, no? And not with the other person, no? Or you could also be doing this kind of sexual activity with someone. So, in a sense, that can be in a social sexual nga relationship. So another sexual behavior is the social sexual behavior. This can be done with a in a homosexual or heterosexual nga behavior. So, we'll start with the heterosexual behavior is the greatest amount of social sexual behavior that occurs between one male and one female. It usually begins in childhood and may be motivated by curiosity, such as showing or examining genitalia. So for instance, if you can actually notice na ay mga bata or child who are really curious when it comes to exploring their bodies, not only their bodies but another child's bodies, no. And this is actually normal. No, this is part of their growth and part of them being able to be curious about themselves and others, no. It's one way for them to be familiarizing with the parts of their bodies. No, so this is not uh, to be um, to be viewed with malice. No, kay they are innocent when they are doing this, so they don't have any like intention of gaining any sexual pleasure from it. No, it's merely out of curiosity that they do this kind of sexual behavior. Right. So we also have petting. This actually differs from hugging, kissing, and generalized caresses of the clothed body to practice involving stimulation of the genitals. So this is usually done, mura bitaw ka ng, in the early parts of the sexual behavior of a person. No. So petting may be done as expression of affection and a source of pleasure preliminary to coitus or sexual intercourse. So this is the non-penetrative sexual nga behavior. No, hugging, no, mura siya dili siya, different siya sa hugging o kissing. So, coitus or sexual intercourse, this is the insertion of the male reproductive structure into the female reproductive organ. This is viewed differently by society according to certain different contexts. For example, if an individual is actually married or dili siya kanang married, no? So, if a person actually does sexual activity before marriage, it can be called as premarital nga sex. No. Now let's go to the physiology of human sexual response. So the sexual response cycle is one model of physical and emotional changes that happens when you are participating in sexual activity. So this can be categorized according to the stages in which a person progresses in doing the sexual nga activity. So go first with the excitement phase. So it is caused by increase in pulse and blood pressure. So musaka ang dagan sa imong dugo ani, no? Kanang this will actually result to increase in body temperature or skin temperature, na ay flushing, swelling of all distensible body parts, more rapid breathing, secretion of genital fluids, vaginal expansion, and a general increase in muscle tension. So it's one way for your body to prepare you for engaging in the sexual nga activity. Plateau pace, it is generally of brief duration. No? If stimulation is continued orgasm usually occurs. So in this part, before sa orgasm or sexual nga climax, it is called the plateau nga phase. No? And sexual climax, this is marked by a feeling of abrupt, intense pleasure, rapid increase in pulse rate and blood pressure, and spasms of the pelvic muscles, causing contractions of the female genitalia and ejaculation by the male genitalia. This is also characterized by involuntary nga vocalization. So, this is where orgasm actually occurs, no? So, sa male, this is actually characterized by ejaculation, no? Ejaculation of semen, and sa female, this is usually characterized by an orgasm pod, no? So um, both sexes actually experience orgasms at this part. And the resolution phase, it is the last stage that refers to the return to a normal or subnormal physiological nga states. So males and females are similar in their response sequence, although lahi ang ilahang pag-respond ani nga part. Sa males, it could be nga wait for a while lang sa. Continue. So the males can actually have a um different nga sexual response to this, no? In that they can have some refractory period. The sexual organ will be in a flaccid nga pace, and it will go limp, no? Di na siya mo kwan og erection. Whereas sa females, they can have actually multiple nga orgasms, no? Unlike sa males, no, wala ni sila refractory nga period or marabitag rest period, no? So they can still engage, no, in another nga sexual nga activity. So we now go to the nervous system nga factors. So for the nervous system nga factors, these are this some parts of your brains, no, and also your nervous system is actually responsible for stimulating or sending signals to your brains that will actually induce you to have sexual arousal, which will lead you to do sexual nga activity. So your nervous system, this is made up of the brain, spinal cord, and nerves. It is the body's communication system that controls much of what your body does. So it allows you to do things like walk, speak, swallow, breathe, and learn, and controls how your body reacts in an emergency. So your nervous system will actually rely on the stimuli that it receives from your environment. No? So for instance, if naa kay stimuli nga makit-an or ma-feel or ma-experience, that stimuli will be received or will be interpreted by your nerves, and your nerves will travel up in your brain through your spinal cords and will send a signal to your brain, and your brain will decide on how it would respond or what signal it would send to your hormones on how you will react to that certain stimuli. No? So the entire nervous system plays a significant role during sexual response. The autonomic system involved in controlling the involuntary responses, and in the presence of a stimulus capable enough of initiating a sexual response, ang imuhang efferent cerebrospinal nerves transmit the sensory messages to the brain. The brain will interpret the sensory message and dictate what will be the immediate and appropriate response of the body. No? So it's actually your limbic system and your hypothalamus which is responsible for regulating your sexual nga behavior. Okay, next. So, there are actually some sexual problems that a person might experience, no? And this could be caused by two things. This could be some sort of physiological problems, and it could be caused by um, psychological, no, problem. So let's go to the physiological problem. So the least among the three categories, some common physiologic conditions that can disturb sexual response include vaginal infections, retroverted uteri, prostatitis, and adrenal tumors, diabetes, senile changes of the vagina, and cardiovascular nga problems. So any conditions or any ailments that might affect in a person's sexual activity, or that might interfere with their sexual activity. So this is normally caused when the normal or proper functioning of the body is affected because the body's organ have malfunction, not working, or the actual cellular structures have changed over a period of time, causing illness. So, usually, if a person has already in their menopausal na period, or if kanang grabe na jud kay sila ka old, no? That's the time that they will usually have difficulties, they will have problems when it comes to doing sexual activity. No? Psychological problems. So this is another one of the things nga cause of sexual problems. No, this is mainly due to psychological reasons or psychological root cause. No, and it's not really due to old age or due to any medical condition. No. So the largest category in sexual problems are usually caused by socially induced inhibitions, maladaptive attitudes, ignorance, sexual myths held by society. No? So you have here premature emission of semen or premature nga ejaculation. No? Kana bitong if a person or a male actually ejaculates prematurely or wala siya control kung kuno siya mag-climax or mag-orgasm, no? So dali ra siya kanang magawsan, no? This is a common problem, especially for young males. Sometimes this is not the consequence of any psychological problem, but natural result of excessive tension in a male who has been sexually deprived. So there are times pod nga a male kanang gamay lang kayo siguro nga stimuli or gamay kayo na any action would lead them to have this kind of condition, no? So, in guys under the age of 40, erectile impotence is nearly typically of psychological origin. So, natay another sexual problem which is ang erectile impotence or erectile dysfunction, no? This is usually common sa mga older nga males. So, physical factors are more frequently implicated, no? So, another thing that will cause this is a guy or affected person is caught up in self-perpetuating condition that can only be cured by successfully performing an act of coitus or sexual intercourse. And this is also usually caused by lack of interest sa isa ka sexual partner, exhaustion, and distraction, or kanabitang anxiety and expectation sa isa ka partner, and also drunkenness and also other factors, no? So this is usually experienced by older males, and they can usually seek the help of a professional or medical doctor with this. They usually prescribe with Viagra or a medicine that will actually enhance their erection, no? Kay di naman kay sila maka-maintain sa ilahang erection. For a person to have or to be able to participate in a sexual activity, then need niya nga maka-maintain sad og degree of sexual nga erection. And also ejaculatory nga impotence, wala kayo'y ga during if mag-orgasm ang isa ka person, gamay ra iyahang marabitag ma-ejaculate, no? And this is actually problematic for some of the couples or some of the married couples, no? Kay if they're actually intending to produce a child or if they actually wanted to have a child, this can come as problematic if ang iyang husband sa couple or ang husband kay gamay ra iyang magawas nga ejaculation. So this results from the inability to ejaculate in sexual intercourse is uncommon and it's usually of psychogenic origin. Occasional ejaculatory inability can be possibly expected in older men or in any male who has exceeded his sexual capacity. So this appears to be linked with contamination beliefs or recollections of unpleasant situation. Occasional ejaculatory incapacity is to be expected in elderly men or those who have outlived their sexual capability. No. Vaginismus, this is also one of the sexual problems. Female is unable to have any sexual penetration with any male nga partner simply because nag-constrict ang iyang female sexual nga organ, no? Making the penetration painful or at times impossible. So this can be treated with psychotherapy or with gradual increase in insertion of some cylinders, no? If it becomes chronic or it becomes debilitating. So this is vaginismus is not always related to an underlying condition and can be caused by stress, anxiety, lack of trust with a partner, incidences such as sexual abuse, denied sexuality. No. So there is actually a psychotherapist or a psychologist who actually specializes in human sexuality. They are actually called sex psychotherapists, no? And there are actually therapists who actually specializes in this kind of concerns, no, or issue. So there. Now let's go to some sexually transmitted nga mga infections. A person can actually transmit infections if they don't have any or if they actually engage in any sexual activity without any kind of protection, no? So, a person without infection can get it from someone with the STI or sexually transmitted nga infection. So, the cause of these STIs, this can be from a bacterial, viral, or parasitical origin, no? So, there are some STIs or sexually transmitted infections like chlamydia or gonorrhea, which are caused by bacteria and which can infect both males and females. But ang nakalahi lang ani nila is ang bacteria, ang gakos ka bacteria, and the clinical or physical features or manifestations ani nga infection, no? So for example, kanisha sa chlamydia, as you can see, there is a white discharge sa genitals sa isa ka female, and this is usually characterized nga murag medyo smelly kay siyang kanang discharge, no? This is not the kanang normal nga discharge nga gaka ginasecrete sa isa ka female organ, but it's usually kanang na siya'y murag kanang distinct yun nga baho. And naapod tayo sa another thing pod is ang female organ infected with gonorrhea. So naa siya mga white nga mga lesions or murag clinical features around sa area sa sexual organ, no? And you also have here syphilis. This is a bacterial infection usually spread by sexual contact. This disease starts as a painless sore, typically on the genitals, rectum, or mouth. And you also have here chancroid or cancroid caused by infection with Haemophilus ducreyi, no? Or I don't know how that is pronounced, no? So muna siya ang murag manifestations, clinical features sa isa ka person with a infected with a syphilis. Ang kani, it's more of the chancroid, no? Murag na ay murag lesions, na ay murag ulcerations at the groin area sa private part sa isa ka male nga person, no? Then you also have HPV or the human papilloma virus. It is a viral infection that's passed between people through skin-to-skin contact or through sexual nga contact. No. So ang kwan ani it's of viral origin, no, or viral ang iyahang infection. This is caused by a certain nga virus. And also natay herpes simplex virus, the most prevalent of sexually transmitted infections that are subclinical and clinical manifestations. Sa HPV, this is only not limited to female nga pwede ma-infect ani but also to the males, no? I think there's already a vaccine of this nga gina-inject sa mga female, no? Sa mga women, and they usually actually avail of the vaccines as early in their early nga mga teenage years, no, for them to be able to be protected from this kind of infection. And also muna siya ang sa herpes, no. And naapod tay, what do you call this, trichomonas vaginalis or vaginalis. This is a common sexually transmitted protozoan infection associated with adverse health outcomes, no? So, same gyapon ni siya og manifestation sa earlier, no, nga naay murag discharge from the vagina or from the female sexual nga organ. So now, in order for a person to be able to protect his or herself from getting pregnant or from getting those sexually transmitted nga infection, that person actually uses contraception. And oh, by the way, before I proceed with that, no, one thing nga wala na ako na mention sa kaganina is ang HIV/AIDS or the human immunodeficiency virus and a AIDS or the autoimmune deficiency syndrome, no. So a person can get that if they actually engage in unprotected sexual contact with a person nga naanay infection. It can also be transmitted through blood transfusion if nakay transfusion nga with someone nga naay HIV, or you can child can actually uh, be infected if mag receive siya og breast milk sa iyahang infected nga mother, no, through breast milk, blood transfusion or sexual contact. Or also it can also be transmitted if you actually share with an infected nga needle from someone nga na-infect with HIV. So, ang HIV, it could actually lead to AIDS or autoimmunodeficiency syndrome, wherein a person's immune system is very compromised na kayo, in that that person will actually experience several opportunistic infections sa iyang immune system that will eventually deteriorate ang iyang health and will lead him to um, actually die, no? Although there are already existing treatment, but ang iyang immune system is grabe na jud kayo ka low, no? So let's now go to the methods of contraception na atay natural or artificial. So ang nakalay lang sa natural nga contraception, it doesn't actually use any kind of foreign objects, chemicals, or any kind of devices. It has more something to do with regulating your sexual activity around a certain period or a certain kind of temperature sa imong body. So natural contraception is considered natural because they are mechanical and not a result of hormone manipulation. Instead, these methods to prevent pregnancy require that a man and woman not have sexual intercourse during the time when an egg is available to be fertilized by a sperm, no? So, ang periods wherein a person is actually experiencing menstruation, okay? Infertile ni siya during a part. So, a person could engage in in these days nga infertile ang isa ka women, no? But it can be, messy since that person is actually experiencing no menstruation. Then a period after that, naatay ginatawag nga fertile nga periods diri nga time nga ovulate na ang isa ka person. And after that, during that time, infertile na siya. So a person has to take note sa iyahang menstrual nga cycle and ihanang i-count ang days nga infertile na siya. So it can be quite complicated, no? If you actually use that kind of natural contraception. That's what they call the calendar nga method. And you also have the abstinence or complete or abstaining from any sexual activity kana 100% nga successful good ang rate ana, no? The person only has to abstain from doing any sexual activity to protect themselves from getting pregnant or from transmitting any STIs. Then you also have basal body temperature. So a person would only engage in a sexual activity at a certain time nga iyang body kay naa sa isa ka certain nga temperature lang, no? So the woman must record her temperature every morning before any activity. A slight decrease in the basal body temperature followed by a gradual increase in the basal body temperature can be a sign that a woman has ovulated. No? And you also have the cervical mucus method. The change in the cervical mucus during ovulation is the basis for this method. During ovulation, the cervical mucus is copious, thin, and watery. So, this contraception method depends on the amount or the kind of cervical mucus that is produced. No? And ang symptothermal method, it's actually the combination of the basal body temperature and the cervical mucus nga method. F, ovulation detection. G, intrauterine nga device. And H, chemical nga barriers. No? So let's now go to artificial birth control. So if what I mean by this is using or utilizing any chemicals or any synthetic material to prevent someone from becoming pregnant or from protecting oneself from transmitting any STIs. No? So you have here different kinds, no? Oral contraceptives, transdermal nga patch, vaginal ring, subdermal implants, hormonal injections, intrauterine device, chemical barriers, diaphragm, male-female nga condoms, or through surgical nga methods. So you can actually review this guys sa inyong PDF. I already uploaded this reference material sa inyong LMS, so you can just check out ang unsay purpose or unsay method aning artificial no nga contraception. So um muna siya ang dagway sa kaning artificial nga contraception. So ang coitus interruptus, this is actually a natural nga contraception. A person just have to withdraw um, his genitalia or sexual organ from that of his or her partner before the sexual nga climax, no? But this is actually not 100% guarantee kay it could be nga a person a man's sexual organ could be already secreting some um discharges or could be secreting some semen na sa isa ka sa isa ka sexual organ sa bae, no? And also surgical sterilization if mag vasectomy or if mag snip na or kanabitang putlo na ang vas deferens sa isa ka laki, no? Murag imo nang ginaputol ang murag pathway sa sperm cell, no? Kaya ang sperm cell gikan man siya sa testis, no? Or ang kanang testicle sa isa ka laki. If you actually cut that vas deferens kanang murag ang tube nga ga-connect sa ila gikan sa testis padong sa urethra, that will actually prevent the sperm cell from going or expelling out from the sexual organ sa isa ka lalaki, no? Or you could actually use the condom that would hold all of the sexual fluids, and that will actually prevent you from impregnating or being pregnant from someone, no? So if you're actually going to rate it from the most effective or the least effective, so muna siya ang murag iyang ranking, no? The intrauterine and the surgical method are the most effective when it comes to preventing any pregnancy. And also, mid-range, okay ra ang hormonal ring, oral contraceptives, and injection or hormonal injection. Least effective ang diaphragm, ang withdrawal, o ang calendar nga method. No, these are dili siya guarantee, no. So probably dili siya 100% nga maka-guarantee nga maka-prevent siya og pregnancy or ma-protect ka from um, transmitting STIs, no. Okay, so actually lahi na ang generation karon, no. Some or most of you might have some experiences now when it comes to sexual activity. So this lesson is actually not to actually encourage you, no, to engage in sexual activity. It's more of to inform you that there are actually ways in which you can protect yourself from getting pregnant or impregnating someone or protecting yourself from transmitting these diseases, no? Because when you are actually engaging in any sexual activity, that will really have consequences, no? Either you can impregnate or you can have a teenage nga pregnancy or early pregnancy, no? And that could really affect your future. So most likely ang consequences ana is mag-stop jud mo og eskwela, no? Maka-stop jud mo og eskwela ana. Kaya you have to take care of your child, no? And also if mag-engage mo in an unprotected nga sexual activity, most likely that will increase your chance of having or transmitting some sexually transmitted nga infection. So one way, some things in which you can do to protect yourself is to follow this A, B, C, D, E of HIV and other STD nga prevention. Letter A, you will just have to abstain in doing any sexual activity. You can probably wait until you are of mature age or if ready na ka, both in financial and personal siguro nga reasons. If ready na jud ka nga magkaanak and if married na jud ka with a partner, then probably that's the only time nga pwede na ka mag-engage sa sexual activity. So you do this activity within the context of marriage na, dili na before the marriage, no. So B, you can be also faithful to your partner, no? Stick lang ka sa isa ka partner and not have multiple nga sexual partners, no? And also C, correct use of condom, no? Or the proper use of condoms when it comes to engaging in any sexual nga activity. So, dili naman gid na malikayan no nga mag-engage ka sa isa ka sexual activity. So, you just have to protect yourselves and correctly use the condom. So I think there are a lot of videos on the internet that will actually you can actually view it on how you can properly use the condom, no? And condoms are also can be bought from pharmacies, any drugstore or any convenience store. And you can also get that from any city health nga clinics or city health nga offices dire sa ato ang syudad, no? And also, don't do drugs or D. It's really not ideal nga mag-engage ka in doing drugs kay there's a possibility nga makatransmit ka og STI labi na if mag-share ka og needles with anyone who is actually into drugs, no? And letter E, education and early detection. Much better if you actually if dili ka sure sa imong status, you can actually get tested for free sa any of the city health departments sa ato ang city, no? Naara na sila yung social hygiene clinic. You can avail of those services for free, no charge or no charge at all, no? Just for you to have a peace of mind nga kibaw ka sa imong status, no? At least ma-detect nimo. And also, if suspected nimo nga rabi tawag, late na kayo imuhang period or late na kayo ka, maybe you can also buy some pregnancy kits, no, from any pharmacies, no. You can also do that, no. One way for you to know if nakaan ang infection is only through tests. Dili ra siya kanang mamata-mata ra gyud, dili na siya pwedeng ay ako ra man nabasahan murag similar ra kay ni siya sa akong gakuan. No, you really have to get tested for you to know if naajud ka ana, no? So that's it. That ends the discussion for the physical and sexual self. Please review the reference material lang since you're going to have a quiz tomorrow, Friday, for this topic. No. So if you have any questions or concern or clarification, please feel free to message me or send a message sa ako ang email or through messenger or through LMS. Okay.